The coronavirus pandemic is a confusing time for all of us, and here at Fox 24, we are committed to making things quite a bit clearer for you. Joining us once again, Dr. Gary Berner with the Community Clinic of Northwest Arkansas. Hey, Dr. Berner, how's it going today?
I'm doing well. Thank you for asking. How are you?
I'm good, and we're happy to have you on with us. A lot of us, we watch the governor's press conference every single day, and I can't help but wonder how many of us actually know and understand a lot of the terminology that is being used. So can you break down what it means when he talks about us reaching our peak?
Yeah, the peak is, it sounds simple, but it's actually a little bit statistically complicated. And so reaching the peak means the point when Arkansas will have the highest number of people currently infected with coronavirus. And so that could be people that were infected 6 days ago, people that were infected yesterday, and people that were infected today. And so that's when we reach the mass number of people that have the infection. And so people that have recovered from it, they'll drop out. And then people that may have been exposed but don't have the disease, they're not included. People that have unfortunately passed away, they won't be included. But it's the people that currently have the disease. When we reach the most number of those folks, that'll be the peak.
Well, that's a good explanation, and thank you for that. I think you cleared up some of my own questions I had. So it's estimated that the U.S. as a whole will reach its peak sometime this week. But what does that mean for us here in Arkansas then, especially since we started seeing our cases much later than states that first saw this outbreak?
We have had a slower increase in the number of cases, which will also push us back. Right now, the reports that we're seeing, initially we're looking at maybe like April 24th as our early projection. That seems to be even pushed back a few days. We cannot tell. We like to give these dates like April 24th or 26th, and we're not able to really say that exactly. So I would even say give or take a week, one side, one way or the other. But thinking the later part of April for when Arkansas might reach its peak. We tend to be trailing the nation by around a week, and that's partly a good thing. That's because in Arkansas the curve is more flattened, which has pushed us back. In addition, we got our cases a little bit later than some states.
What does it exactly mean to flatten the curve? I know that we've been talking about it so much, but just getting that out there in the atmosphere so that people actually understand it.
Yeah, I really appreciate defining these terms. I think that does make, helping to define these terms, I think that makes a big difference. So to flatten the curve means to flatten the rate or how fast we increase the number of cases in Arkansas. So let's look at maybe lower numbers. And so if we went Monday, Tuesday, Wednesday, a fast rate would go from 1 case to 5 cases to 10 cases. That's increasing really rapidly. A curve that's more flattened would be if we increased by 1 cases and then 2 cases and then 4 cases per day. So it's the number of new cases per day that are popping up is how fast we're increasing. So we can do that more slowly than we're flattening the curve.
Once we do hit that peak in Arkansas, I think a lot of people are thinking they're going to be able to return to normal life almost immediately, but doctors like yourself are saying that's just not the case. Can you explain why that is?
Yeah, the fact that we're able to think about maybe reaching our peak on April 26th, really we need to look at that as motivation and encouragement that what we're doing is working, but not as a sign that we can stop our social distancing. That's showing that the current measures that we're doing is slowing the virus and lowering that peak number that we're going to get. And so that means we really need to keep with the same lifestyle, social distancing measures and focus that we've had. Not that we're looking at being able to reverse back to our previous fun lifestyle back in January and last October. We can't look at that yet. It's taken us a while to reach this peak, and it's going to take a while after before we can start to return back to our normal activity.
A lot of great information as always, Dr. Berner. Thank you always for joining us. We appreciate your time.